The update for Proposition 56, just to take 2 steps back. As you recall, in November, we won an election where we beat big tobacco, and we added a $2 tax onto a pack of cigarettes in order for that to improve provider payments. The discussion that was coming into January was what portion of that revenue would be dedicated specifically to increase physician reimbursement payments. It was a long fight. That fight started in January, unfortunately, when the governor proposed a budget that had no increases for physicians in their reimbursement rates within the Medi-Cal system. I'm happy to say that that fight ended with physicians being, the portion dedicated to physicians is over, when you combine state and federal funding, it's over $700 million, approaching $1 billion. We'll have growth that will happen into the new year. That money will be divided amongst specific CPT codes as determined by the Department of Healthcare Services and approved by the federal government through a state plan amendment. That approval should occur by the beginning of the fall of this calendar year, but it will impact payments dating all the way back to the beginning of the fiscal year, which is July. So essentially, we will see 20–30% increases in specific CPT codes designated by the Department of Healthcare Services once we get that approval from the Department of Healthcare Services, and those will be pass-through payments for people in fee-for-service and managed care. So the update is we had a hard fight in the election. We had a hard fight with the governor of California. We won that fight. We have $700 million in additional resources going out to physicians. It'll be in the form of supplemental payments that will be available to both fee-for-service doctors and managed care doctors based on CPT codes identified by the Department of Healthcare Services.